Let me wipe my screen. Ooh. New weekly challenges. So now I have the ability to like my live again. On TikTok, it had took away the ability. Or should I go here? Should I go here? Okay. Whatever. Y'all, I'm dressed like this because ooh, I'm dressed like this because a friend took me out to lunch today as a happy belated birthday present. But let me go to, I'm doing this live specifically because about A&P, anatomy and physiology, because someone had reached out to me and said that they are struggling in the A&P. They're ready to give up. They're crying not every day, but they cried their last class. So I want to help as much as I can. So I told her I would go live today, and I don't know what specific topic or chapter, because I asked her to send me her book that they're using. I don't know what specific chapter they are on or focused on right now, so I kind of have to be a little broad and a little generic, but that's okay. We're gonna talk about it. So give me a minute. When I was in nursing school, we did not have AI. We did not have ChatGPT. We didn't have Gemini or whatever else the people are using. But I can say that Quizlet was your best friend. And what else helped me? Of course, reading, obviously. Doing index cards for certain information, like certain information that you needed to memorize, because you can't memorize stuff in nursing school. Like, you're gonna fail yourself if you try to memorize things. There's just too much stuff to memorize. But for the stuff you do need to memorize, index cards, doing notes, Quizlet, and Pinterest. I've made a few posts about that. Pinterest is great for images. Like, if you're a visual learner and you need pictures of things, Quizlet is great. So, like, you can go on there and find mnemonics to help you memorize stuff. I remember they had a image on Pinterest of the cranial nerves, and the way they had it designed, it helped me remember what each cranial nerve was, where it was, what the function was because of that picture. You could look at like pictures of the heart and how the blood flows, and that can maybe help you visualize and remember during your test, especially in A&P, during your test, which way the blood flows. So Pinterest is great. Pinterest is great. All right, so let's look at this. Okay, so this particular person that I wanted to target during this live, she said that she is in an LVN program. So until I can get more information from her and see like what specific chapters that she's focused on or what her specific struggles are, um, I'm gonna just guide in a general way right now. Okay, so when you are assigned your chapter, of course, you're gonna have to read the chapter, of course. Highlight the most pertinent things, and then you want to think in patterns. So every system ultimately follows the same formula, things that you want to focus on for those systems. What structures make it up? What is its main function? How does it maintain homeostasis? What happens if it fails? If you can answer those 4 questions for each system, you will pass. Okay? Now, for your book, reading your book, obviously, most nursing school books are really thick. So now that we have the luxury of AI, what you can do is use your AI to kind of like pre-read, and you can do that by your objectives. So each chapter is gonna start with objectives. So look at your objectives first, read your objectives. You can take a picture of your objectives, put it into ChatGPT. So technically, I guess the only part you're pre-reading is your objectives. Look at your objectives, take a picture of it, put it into ChatGPT, read your chapter. Then, after you read your chapter, put it in there, put it into the chat GPT and ask ChatGPT, based on these objectives, give me 10 to 20 NCLEX style, because you always want to practice for the NCLEX no matter where you are in your program. Give me 10 to 20 NCLEX style questions based on these objectives. Something of that nature. And then you can even take pictures of the headings of each paragraph or each section, and you can turn headings into questions. So for example, functions of the digestive system, and you can ask, hey, can you give me questions related to this? Or you can even ask yourself before or after reading that, if your heading says functions of the digestive system, once you get done reading that section, ask yourself, what are the main functions of the digestive system? Because you already know you're going to need to know that. Okay, make clinical connections. So if you're studying and your system is the kidneys, you're going to need to know about urine output, fluid balance, lungs, O2 saturation, heart, pulse, function of the heart, which way the blood flows. If you need like a structured weekly study system, I'd say day 1, Skim the chapter, write down key structures, define vocabulary. And I would take pictures of the objectives. Day 2, deep read. Day 3, teach it back to yourself. And then that's when I would ask the chat for the questions. Give me 10 to 20 NCLEX style questions. Day 4, review your weak areas. The first and the longest. Review your weak areas. And then quiz yourself. There's no way, I've said this before, that there's no way in nursing school, even A&P, even if like you're taking prereqs, you're taking A&P, you're not in nursing school yet, but just go ahead and get in the habit of, there's no way that you can cram. In nursing school, there's no such thing as cramming. If you think that you're going to be able to cram, you are setting yourself up for failure. Just letting you know. You have to prepare days ahead, weeks ahead. There's no cramming. Okay, what you should emphasize as a nursing student in A&P, what you should emphasize in A&P, directional terms like medial, lateral, anterior, posterior, tissue types, organ system functions, basic fluid and electrolyte balance, basic immune response, and cardio and respiratory physiology. Those show up constantly in nursing school. There's certain, if we go back to which one, basic fluid and electrolyte balance, there are certain labs that you're gonna have to just memorize, because there's certain particular labs that you're gonna see over and over and over and over. You're gonna see them so much that literally the only thing that you can do is memorize those. You have to memorize those. So like potassium, you're gonna see all the time, magnesium, calcium, hemoglobin, white blood cell. Those are the ones that are sticking out in my head right now. But you're gonna see them so much that you're gonna have to just memorize them. And you need to know what's considered normal. You have to know what's considered normal so you can know what's out of range. I have this humongous study guide. It has lab values in here. Let me just find them real quick. I thought about selling this study guide, but I don't know if I'm gonna do that, because literally I would have to sell this study guide for at least, like $60 because it's so thick. It's 400 plus pages. Let me find lab values. Okay, here we go. Actually, I lied. It's 515 pages. lab values. Your metabolic panel, sodium, calcium, your cholesterol. Certain ones you're gonna see a lot. Certain ones you're gonna see a lot. Let's see if we can just do like just a few A&P questions. Oh my goodness. I just logged out of my computer. Okay. All right, I'm still logged into school. Okay, so we're gonna do a couple of questions from each body system. This is like a study guide, just a basic A&P study guide. And if I was working with a student, and I had more information about what specific thing that they did need help with, and I could more tailor it to that. But this is just some basic study style questions that you would see in A&P. Okay, we're going to start with the integumentary system. The integumentary system. Okay, so the 3 layers of skin. The 3 layers of the skin. What are the 3 layers of the skin? The 3 layers of the skin are epidermis, dermis, hypodermis. Epidermis, dermis, hypodermis. And like I said before, if you are a visual learner and it would help you to remember the 3 layers of the skin by looking at it, you can go to Pinterest, type in the 3 layers of the skin, and it will give you pictures. It will give you pictures of the 3 layers of the skin and outline each area, so you know exactly which area is. Epidermis, dermis, hypodermis. Hypodermis is the subcutaneous. Which layer contains blood vessels? The blood vessels are in the dermis. The blood vessels are in the dermis. The epidermis is avascular. The dermis supplies nutrients and helps regulate temperature through vasodilation and vasoconstriction. Okay? Number 2, what is the primary function of melanin? What is the primary function of melanin? Answer: melanin protects against UV radiation. Melanin protects against UV radiation. The rationale: melanin absorbs harmful UV rays and reduces DNA damage, lowering skin cancer risk. All right, number 3, why is skin part of the immune system? Why is skin part of the immune system? The answer: it acts as a physical barrier and contains immune cells. It acts as a physical barrier and it contains immune cells. Rationale: your skin is the first line of defense against pathogens. That is why it's part of the immune system. It is the first line of defense against pathogens. All right, we're going to move on to the skeletal system. Skeletal system. What are the 3 main functions of the skeletal system? What are the 3 main functions of the skeletal system? Answer: it is to support, protection, and movement. Support, protection, and movement. Something else it does, it also mineral storage and blood cell production. But the main functions: support, protection, and movement. Rationale: bones protect organs, such as the skull protecting the brain, stores calcium, and houses red marrow for hematopoiesis. Hematopoiesis. That word is HEMATOPOIESIS. Red versus yellow marrow. Red versus yellow marrow. What is the difference? Answer: red equals blood cell production. Yellow equals fat storage. Rationale: red marrow produces red blood cells, white blood cells, and platelets. Red marrow produces red blood cells, white blood cells, and platelets. Also, by the way, I'm gonna turn this into a PDF and put it on my in my school community. So if you are a nursing student or potential nursing student, or if you're in A&P, you're not in nursing school yet, but this information will help you. I'm gonna put the school community link in the comments. Join the school community because there's resources, there's tools, there's printouts you can have access to in the school community, and the school community is free. So you really don't have a reason to not join, especially if this information is put the link in the comments and pin it. Okay. So I'm going to turn this into a PDF, upload it in the school community so you can have access to it anytime you want. It's free. Help me help you. It's free. Help yourself. All right. Now, what happens when blood calcium drops? What happens when blood calcium drops? Answer: parathyroid hormone releases calcium from bones. The parathyroid hormone releases calcium from bones. Rationale: maintains homeostasis, but long-term leads to bone weakening. Okay, we're moving on to the muscular system. Okay, what are the differences in muscle types? What are the differences in muscle types? Skeletal is voluntary. Smooth muscle is involuntary. That's your organs. Cardiac muscle is also involuntary. That's your heart. Rationale: structure matches function. Skeletal, voluntary. Smooth, involuntary. That's your organs. Cardiac, involuntary. That's your heart. What is the essential electrolyte for contraction? What is the essential electrolyte for contraction? The answer is calcium. Sidebar: potassium is also important, but calcium is essential for Royal, can you stop eating my plant? The dog eating my plant. All right. Rationale is calcium triggers actin-myosin interaction. What effect does severe hypokalemia have? What effect does severe hypokalemia have? First of all, what is hypokalemia? What is hypokalemia? Hypokalemia is low potassium. That's what it is, low potassium. So what effect does severe hypokalemia have? The answer is muscle weakness and arrhythmias. Oh, no grades back yet? I'm sure you did well. I'm sure you did well on your midterm. I'm sure you did. I'm sure you did. Oh, nice. So you passed, right? No. Is that a pass or fail? That's usually how it goes, unfortunately. Oh. Are you in nursing school or are you doing prereqs? Yes, first semester. If you see my pinned comment, get in the school community because it's free. It's free. But there is information in there. Like I'm doing this this basic general information, and I'm gonna put the PDF in the school community. But like if you were to reach out to me or DM me or message me or something, and you need help with something, but you tell me like specifically, like send me a picture of your book, what exactly are y'all focused on right now, and what topics you need more help with, then I can more tailor it to like something specific. But yeah, get in the community. I would love to help. So there's an app called School. It's SKOOL. And it's like different communities people have where they're basically like teaching things. Like there's all kind of random school communities, but my school community is focused on, my school community is focused on nursing students and new nurses. That's what my school community is focused on. And I upload lives, and I upload tools and resources specifically for nursing students and new nurses. And I helped tutor people, and yeah, and it's free. So if you need help, just reach out. Okay, where was I? Nervous system. Thank you. Nervous system. All right, what are the two main divisions of the nervous system? The two main divisions of the nervous system, that's your central, CNS, and peripheral, PNS. Central and peripheral. Your CNS is your brain and spinal cord, and PNS connects body to CNS. What is the function of myelin? Myelin, MYELIN. Answer is it speeds nerve impulse conduction. Speeds nerve impulse conduction. Rationale, myelin acts as insulation. Myelin acts as insulation. Sympathetic versus parasympathetic. Sympathetic versus parasympathetic. Answer. Sympathetic is your fight or flight. Sympathetic is your fight or flight. Parasympathetic is rest and digest. Parasympathetic is rest and digest. Rationale, opposing systems maintain balance. Okay, we're going to move on to the endocrine system. Endocrine system. Endocrine versus exocrine. What is endocrine versus exocrine? Answer: endocrine is the hormones into the bloodstream. Hormones into bloodstream. Exocrine is ducts, D-U-C-T-S, ducts to surface. Rationale: hormones act systematically. Next, what is the hormone that lowers glucose? What is the hormone that lowers glucose? Answer is insulin. Insulin is the hormone that lowers glucose. Rationale: it moves glucose into the cells. Next, what is it when you have too much thyroid hormone? Too much thyroid hormone working in my eye. Is it not dark? Well, I'm Central Standard Time. It's dark over here. Too much thyroid hormone is hyperthyroidism. Hyperthyroidism. You are right. Sometimes, or a lot of times, you will see weight loss and tachycardia. Rationale is increased. Okay, yeah, it's early there. Increased metabolic rate. Rationale: increased metabolic rate. Okay, cardiovascular system. What is the blood flow pathway? The blood flow pathway. So we go from the right atrium to the right ventricle to the lungs to the left atrium to the left ventricle. Right atrium, right ventricle, lungs, left atrium, left ventricle. And if you weren't here earlier, I was saying if you're a visual learner, and the best way for you to remember things is through images, a great resource is Pinterest. That's another app, Pinterest. So if you go on Pinterest and you were to look up blood flow pathway or nursing school, nursing pictures of the heart or something of that nature, Pinterest will show you pictures of the heart with it outlined of what's what and the flow of the heart. It will give you a picture, a visual, and a lot of times that helps you remember. And I was also saying earlier that I remember the image in Pinterest helped me remember the cranial nerves, because the cranial nerves, there's a lot of them. And we had to remember where they were, the function, what they did, where it was located. And there was a picture I found on Pinterest that it was the numbers, and the numbers, they made it into a face. So it just really helped me remember where was what and what number was. So Pinterest is a good resource if you need pictures. So rationale, pulmonary, then systemic circulation. Yeah, that's a good picture. It really helped me remember. What is the function of hemoglobin? The function of hemoglobin. It carries oxygen. It carries oxygen. Rationale, it binds O2 in the lungs, releases to tissues. Binds O2 in the lungs, releases to tissues. Okay. Left ventricle failure. Left ventricle failure. How do you know? Or signs that there is left ventricle failure? Answer is pulmonary congestion and shortness of breath. Pulmonary congestion and shortness of breath. The rationale is blood backs up into lungs. Okay, so moving on to the respiratory system. Respiratory system. Okay, the question is, where does gas exchange occur? Where does gas exchange occur? The answer is in the alveoli. Alveoli. Rationale, thin walls allow diffusion. What is the role of the diaphragm? What is the role of the diaphragm? Answer, it contracts to pull air in. The rationale is it creates negative pressure. Okay, what happens to oxygen levels in COPD? What happens to oxygen levels in COPD? Your answer is decreased oxygenation. Decreased oxygenation. The rationale is damaged alveoli impair exchange. Damaged alveoli impair exchange. So I can't remember in A&P if you're gonna get questions about like a lot of times what do they tell patients with COPD, like how they should breathe if they're starting to feel short of breath? Is pursed lip breathing, like pursed lip breathing. You'll see that a lot when it comes to COPD, but that's in nursing school for sure. You're gonna see that. I just can't remember if A&P was one of those places where you see that. But just remember, COPD is associated with pursed lip breathing. Okay, the digestive system. Main functions of the digestive system: ingestion, digestion, absorption, and elimination. Ingestion, digestion, absorption, and elimination. Rationale, it's going to break down food and absorb nutrients. So where are your nutrients absorbed? Where are your nutrients absorbed? They are absorbed in the small intestine. In the small intestine. Next, why is bile important? Why is bile important? The answer, it emulsifies fats. Emulsifies fats. Rationale, it helps fat digestion and absorption. Okay, on to the urinary system. Urinary system. What are the main kidney functions? Main kidney functions. It filters the blood, regulates fluids and electrolytes, and removes waste. Filters the blood, regulates fluid and electrolytes, and removes waste. The rationale, it maintains internal balance. Okay, next, role of the nephron. What is the role of the nephron? The answer, it is the functional unit of the kidney, filters and forms urine. filters and forms urine. Rationale controls reabsorption and secretion. Controls reabsorption and secretion. Okay, what happens if kidneys cannot regulate potassium? If kidneys cannot regulate potassium, the answer is hyperkalemia, which causes arrhythmias. Rationale: potassium affects cardiac conduction. Hyperkalemia is high potassium. That's what hyperkalemia is. High potassium. Okay, lastly, our last system is the reproductive system. Reproductive system. What is the hormone that triggers ovulation? What is the hormone that triggers ovulation? It is the LH hormone, luteinizing hormone. Luteinizing hormone. LUTEINIZING. LH. Rationale: the LH surge causes ovulation. Next, where does fertilization occur? Where does fertilization occur? Answer: it occurs in the fallopian tube. In the fallopian tube. Typically in the ampulla. 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 What is the primary function of testosterone? What is the primary function of testosterone? Answer: male sex characteristics and sperm production. Male sex characteristics and sperm production. Okay, we have some bonus clinical thinking questions. Okay, why does low albumin cause edema? Why does low albumin cause edema? Due to decreased oncotic pressure, which causes fluid to shift into the tissues, ultimately causing edema. Why does heart failure cause shortness of breath? Why does heart failure cause shortness of breath? The fluid backs up into the lungs, impairing gas exchange. Impairing gas exchange. And other obvious signs of heart failure is edema as well. Swollen feet, swollen ankles, shortness of breath. Okay, why does dehydration cause confusion, especially in the elderly? Why does dehydration cause confusion, especially in the elderly? The answer is reduced cerebral perfusion and electrolyte imbalance. And it definitely happens that way. Once you do become a nurse and you get an elderly patient and all of a sudden they're starting to act confused, the first thing, well, not always the first thing, but one of the first things you're going to check for is a UTI. Because a lot of times they start acting like that because they have a UTI. That's just a side note. Why does a fever increase heart rate? Why does a fever increase heart rate? The metabolic rate increases and the heart compensates. Metabolic rate increases, the heart compensates. And then lastly, why does someone with diabetes have a higher infection risk? Why does someone with diabetes have a higher infection risk? And it's because high glucose impairs immune response. High glucose impairs immune response. And that's why a lot of times people with diabetes end up with wounds, especially on their feet, because they'll step on something and they'll whatever. They have neuropathy, so they can't feel it. So they have no idea that they have this wound on their foot, so they don't take care of it. They don't know it's there. It becomes infected. They have diabetes, so the infection, they can't really fight the infection. So now the wound travels from their foot up their leg. They end up with amputations. Like, it's just, diabetes is just not a fun disease to have. So that is the end of my questions for today. Like, I can tailor these questions. I usually just kind of like, some days I do med-surg questions, some days I do like fundamental questions, sometimes I do I did A&P today because someone asked me about A&P. But anyone can like message me, reach out to me, tell me what it is like you're needing help with. Girl, I wasn't either at first. I'm still not. It's just one of those things, like, once you start doing it, it just gets a little easier each time. I try to do Wednesdays either at like 6 p.m. Central or 7 p.m. Central. So I try to do Wednesdays and Sundays. So Wednesdays is in the evening. Sundays is at 3 p.m. Central. And if I miss a Wednesday, I usually do not miss a Sunday. Because I'm off on the weekend. So it's just easier. It's easier to not make an excuse or have something going on with my kids, or I'm getting in late, I'm tired. Something like that. So I try to do Wednesdays and Sundays. If I miss a Wednesday, I'll be on Sunday for sure. Awesome. Thank you. I appreciate you for liking the live. So hopefully I'll see you on more often. And then like I was saying, you can DM me on TikTok, or you can join the school community and you can message me on there. And then even if you do get into the school community, you can go back and see all the other lives I've done are on there. Like all the replays are there, and then all the stuff that like all the resources I've uploaded on there, like a lot of my old notes from when I was at nursing school on there. So there's other stuff on there that's not on my TikTok. So, and I put the link in the comments, and it's also in my bio. As well. So, all right, I will see you guys on, what is today? Monday. I will see you guys on Wednesday. All right, y'all have a good night.